Namaste everyone, welcome to Net Guidance. In this PPT, we are going to learn about femoral artery, femoral nerve, and sartorius. So, femoral artery, its origin is from it's the continuation of external iliac artery. It enters the femoral triangle behind the inguinal ligament at the mid-inguinal point. Its termination is it leaves the thigh through the adductor hiatus to enter the popliteal fossa, where it continues as the popliteal artery. The branches are in the femoral triangle. It has three superficial branches. One is superficial epigastric artery, and the second is superficial pudendal artery, and the third is a superficial circumflex iliac artery. And it has three deep branches. One is profunda femoris artery, and second is a deep external pudendal artery, and third is the muscular branches. This is one of the branches from the femoral triangle. And the next is in the adductor canal. It has muscular branches, and the second is descending genicular artery. Next is applied anatomy. Is it has three aspects. One is compression, second is palpation, and third one is the cannulation. In the compression, if the femoral artery can be compressed against the femoral head at the mid-inguinal point to control the bleeding in the distal part of the limb. If there is any bleeding in the distal part of the limb, when the femoral artery is compressed, the bleeding can be decreased. And in pulsation, the pulsations of femoral artery are felt by clinicians in the femoral triangle just below the mid-inguinal point. And third is the cannulation. As it is a superficial one, it is used mainly in the cannulation. Next is femoral nerve. Its origin is from the dorsal division of the anterior primary rami of L2, L3, L4 nerves. Its root value is L2, L3, and L4. It enters the thigh posterior to inguinal ligament and divides into anterior and posterior divisions. Its branches are, it has mainly anterior and posterior divisions. In anterior divisions, we have two cutaneous nerves. That is, one is a medial and second one is the intermediate cutaneous nerve of thigh. The second one is one muscular branch that supplies the sartorius. The posterior division, we have one cutaneous branch, the saphenous nerve, and four muscular branches to supply the quadriceps femoris. Applied anatomy is that if there is any injury to femoral nerve, uh, there is a loss of, in a motor we can see paralysis of quadriceps femoris, and sensory is that there is loss of sensation on the anterior and medial aspect of the thigh. Next is sartorius. It is the longest muscle of the body from lateral to medial side of the thigh. Its origin is from the anterior superior iliac spine, the upper half of the nose. It's there, and it is inserted on the upper part of the medial surface of the shaft of tibia. And the nerve supply is from anterior division of femoral nerve. And actions are, it flexes the knee joint and hip. It abducts and rotates the thigh. Thank you. Good luck for your future.